Hi, we're the Thera Sisters. Two sisters, therapists, and your new favorite podcast hosts. We're here to make therapy fun, comfy, and stigma-free.
We chat with fellow healers and guests about their own healing journeys, how they help their clients heal, and how they see healing in a whole new light.
How do you heal? Do you even know? Tune in and you might just find your perfect healing fit.
Don't forget to subscribe and share with a friend who could use healing vibes. Giggles, glimmers, and a whole lot of heart. Healing together, one laugh at a time.
Hello.
Welcome to Thera Sisters STL.
Yay, who do we have today?
We are here with Coach Jen and Coach Angie.
Yes.
So it's Jen Schrorer and Angie Maguire, and they are with the Nurse Coach Duo. We are so excited to talk with both of you today and learn more about how you are helping women through this transitional period in their lives where things just feel upside down and we kind of question what's wrong with us, right? And so we are really excited to learn about how you help women reclaim their energy and all of that you do. So
Their mental wellness, their confidence, the idea that they're not losing it, all of it. Yes.
And their physical health. So welcome. And
thank you. Thanks for having us.
Kind of dive in and then
Yes.
Yes.
Yeah, thanks for joining us. Because you guys have a YouTube
Channel. Mm-hmm. Yep.
Channel. Yeah.
And you do shows.
Yes. So yeah,
we do
episodes where we
Nurse
interview
Coach Duo,
people.
That's
Go ahead, Angie. You go.
Yeah.
Oh, okay. No, so we've, our goal is to not only bring different practitioners on, but also bring other nurse coaches on the channel to, get the message out to our listeners about nurse coaching and all the different stuff that nurse coaches are doing out there today. Then also bringing on practitioners that, and those nurse coaches are working also with women in midlife as well. And then practitioners that are also working with women in midlife.
Okay. So then does your channel help? Does it also support the coaches that you bring on and learning helpful ways to coach, or is it all focused on how you're helping others?
Yeah, so we like to bring on, if it's a nurse coach, we bring them on and helping us to understand like how they implement different things with people using their nurse coaching. So we all kind of approach nurse coaching in our own way. We have hypnotists out there, sound therapists. Angie and I are, menopause, midlife coaches. So everybody's using a different avenue of how they are using their nurse coaching. So it's really the way that we bring nurse coaching into it is to say, first of all, the two of us are nurse coaches and let us help you with what's going on in your body, how you're feeling, give you ideas of what you can implement to feel better instead of, just wondering what's going on or believing what you're seeing on social media that might not be accurate, giving you some evidence-based advice and strategies, bringing experts on, like Angie said, so practitioners, and then also nurse coaches that are doing things that can help you, whether it's with stress, exercise, just not feeling like yourself, whatever it is. So we want to make sure that people understand that nurses are out there to helping, and we're not just at the bedside, we're out there to help, and we are helping in so many different ways. And we are really part of that care team. I mean, it takes a village. You guys know that, right? It takes a village to help people feel better. And we're part of that village, and we're here just to support them in any way we can.
Awesome. So it sounds like you just kind of gave a description of what a nurse coach is, but Angie or Jen, do you want to add kind to that definition of what is a nurse coach?
Go for it, Angie.
A nurse coach is a nurse that has experience in nursing. I think, before we sit for a certification, you have to have, to even start a certification program, you have to have at least 2 years of nursing experience. And then we go through a coaching certification program, and we use the nursing assessment in our assessing our clients. So we, and that's what, nurses do best, I think, is we're great assessors and communicators and creating plans and interventions for people. So we use that process when we work with our clients. So, and again, as Jen said, nurse coaches can work with anyone they want to, basically, any type of patient, a diabetic, some people want to do only diabetes, or, just it can run the gamut. So, but Coach Jen and I happen to focus on women in midlife around perimenopause and menopause. So the nurse coach brand is a little bit confusing, because when we introduce ourselves as nurse coaches, people immediately think, oh, well, you coach nurses. And that is actually something that I'm, passionate about as well, as coaching nurses, but around wellness. But it is confusing for people. So we're constantly explaining what we do and who we are. But, we're nurses to begin with. And with coaching, more coaching, sort of with the coaching certification. So.
Understand. Yes. And so what got the two of you interested in women at this time in their life?
Yeah, so I think we each probably have our own story. So I can tell mine, Angie, and then you, if you want to tell yours. I won't make it too long, but so basically, I'm a 49-year-old woman now. But when I turned about 38, I got off of birth control because I was having some complications and I wasn't feeling well, and I realized that for the first time in my life that I didn't really understand what was going on in my body, because I hadn't ever been cycling because I was on birth control for 20 years. So when I started realizing that my body was changing week to week to week, I'm like, I need to understand this better. Like my scientific brain, my nursing brain wanted to understand it to a different level. So I kind of learned a lot about that. And in the process of learning what was going on with my cycle, of course, I started going into perimenopause. I'm like, what the heck is this? Why am I feeling so horrible? Started learning about perimenopause and realized there's just not enough answers out there. And women are suffering. And unless you are like Angie and I, and we are submersed in it because we just are nerds about it and we love it, you really aren't getting the information that's out there. You're just missing it. So I wanted to be able to I wanted to do the coaching, and I wanted to find a group that I felt like I was best equipped to help. And I felt like, because I'd found all the education and learned it and figured out how to help myself, I could then go help other people with that as well. But whenever they're probably feeling the same way I did, and nobody should have to feel that way. We should have answers out there. And unfortunately, when we go to our providers, we're not always getting those answers. So that's kind of how I ended up in that portion of or group of women.
And 38, I think a lot of people would think that's really young to be starting that process.
Yeah, a lot of people do think that's too young, and it's not. Yeah, it's not. I would say anybody over 35, if you're starting to feel a little bit like, oh, my cycle isn't the same, or starting to notice in symptoms, they're very easily possible that 35 and older, you're in perimenopause. By 40, no question. Symptoms or not, you're in it. Just own it. Know it, you're in perimenopause. Perimenopause is just the time before menopause. We get too caught up on what symptom is it? What does it mean? All this, it's not a diagnosis. It is just the time before menopause. And we can be experiencing that anywhere from 8 to 10 to 15 years. It changes with race. It changes with just in between people. You two are sisters. You guys could experience it completely different.
Mm-hmm.
Yeah. So Angie, I don't know if you want to tell your story.
So individual. Yeah. I mean, I think, similar to yours as, being in midlife and recognizing the changes, but also I'll just add on to, as a nurse really, and a nurse coach, really found that, just the lack of knowledge and awareness, amongst women in midlife, hearing from friends, family, and just really felt there was a need in this area for education and awareness and coaching. So that's, my heart went into it, right? Like that's, what we do. And I went for it for that reason. And I mean, my own story, I feel like I'm 53, and I think my 40s, I had no idea really what was going on. And no one even mentioned the word perimenopause to me. And again, that's why I'm doing what I'm doing, because I want people to know, and I want 40-year-olds to know. I want I want people to have better understanding about their bodies and what's going on, to reduce a lot of anxiety and everything that it causes. And also just to help where we are in our health system too. We get 7 to 10 minutes with our providers, and to really prepare women going in to seek, when they're wanting to talk about this time of life, being ready and advocating for themselves. So that's another reason I have chosen to work with women in midlife. And, do I wish the health care system was a bit different and the model was different? And the practitioners had more time, or docs and NPs and women's health nurse practitioners had more time, but they don't. And so I feel like nurse coaches can really help with that, the link to care, as you probably in your work do all the time as well.
Yeah.
Or strive to.
Yes, a little bit. Yeah.
Yeah.
Well, I think this is such a great time to, like, I feel like generationally,
Yes, the Generation X.
yeah, like generationally right now are like, no, I want to know what's going on with my body. I need to know what's going on with my body. And I'm not trusting the lack of information that we have, right? Like, because there have been very few tests and research on women and their aging bodies, right?
Yes.
And we know a lot of reasons of why. But it's like, yes, we want to know, we need to know, like, and so
Absolutely.
it's amazing that there's women out there like you who are right? We are going to help you know.
Yes.
Yes.
So
I tell people all the time, my husband knows more. Sorry. I was just going to say, I tell people all the time, my husband knows way more about menopause than any man ever has known, because I don't shut up about it. So,
well, it's good. We need to inform the men as well, right?
Yes.
They need to know and support their women and not use the excuse of, oh, well, I just thought it was your hormones and you were just angry all the time, so I just left you alone.
right.
It's like, well, that's not always the best way to handle it.
Right. Well, and I think that is a big thing. I mean, coming from a couples therapist, right? And even conversations I've had with my husband of like, I don't want you to be scared of me, right? I want you to understand me, and maybe, and maybe I'm scary because I'm needing support or I'm needing something, or, and not feel like to just leave me alone.
Yeah.
Right.
Yeah. Yes.
But
I think that we work, as you all work, to reduce the stigma around mental health. It's one of the reasons I'm also in this world, is trying to reduce the stigma around menopause and what it is. And, it's not a dirty word, it's not, it's part of life, and we're living longer, and people need to know about it, right? And really understand their bodies. And as Gen Xers, we didn't get that in our, no one told us about it. And that's, what Jen and I are very passionate about, getting information, right information, science-based, evidence-based education or information out there.
Yeah. Because yes, I love to know and understand the whys of things, which we don't always get the answer to, but I like to be like, this is why I'm having these terrible hot flashes in the middle of the night, because you guys know whatever's dipping or rising or something. And no, it's so helpful. So it's good that you guys know the science and can share that piece of it, that it's not like, I don't know, we're going crazy, or it's not real, or you're making it up. It's not as bad as you said it.
Yeah. Knowledge is power. And when you understand what's going on in your body, it's so much easier to accept, right? So it doesn't mean that, oh, I don't have the hot flashes anymore. It doesn't mean I don't have the mood swings anymore. But now I can say, you know what? Maybe I'm having a low estrogen day. Maybe that's why I'm not feeling or if you are still cycling and you know where your cycle is, you're like, oh, you know what? This is my, my same 5 days before my cycle. I always feel this way. It just gives you a little bit of grace for yourself to go, it's not me. I'm not, a B word. I am actually being affected by what's going on in my body, and that's okay. And I can now figure out, what do I do to make myself feel better? It's so powerful.
Yeah. Yeah, because hormones play such a role in our emotions and our energy. It's just amazing how it's all connected.
Yes.
Yep, you're absolutely right.
And it's so, as we've already said, so individual. And I think, amongst women, one person can have a hot flash and someone may have never had a hot flash, right? Or, I hate to always talk about hot flashes, because that's just, that's a sign that shows up much later and often before, we really know what's going on. But there's some women that have very little symptoms, and then there's some that really suffer. And I think the way we can think about that, or what I talk about, is, women that we know, who went, or friends that we knew who went through puberty, right? That had, really had to stay home a day, or, bled through their pants in 7th grade, and just in like, they had more severe symptoms, right? And, it's our hormonal based, right? And how people experience it and tolerate it. And same in postpartum. And then it's really the third P is perimenopause, puberty, postpartum, and perimenopause. And so it's just normalizing that. And also just all of us being individual and caring for one another, and not judging someone if they never had a hot flash,
Well, yeah, my sister-in-law, she's a few years older than me. And she's like, no, I've never had hot flashes. Or I'm like, how are you getting through this? No issues. It's astounding to me. Good for her. I mean, good for her. Talking earlier, so I was probably going through perimenopause in my early 30s when I was trying to get pregnant and couldn't. We had to go through IUI, but I think part of it is, this is my joke, is that I'm the black widow to sperm, because they do a little test where they go in and they look, you guys have sex, and then they go and look in, and it's like one side, they were all these dead sperm. And then this other side, there was like just a few floating around in there. But anyway, enough of that. But no, because my cycles were way off during the time too. And no one ever thought to suggest, well, maybe you're going through perimenopause and that's why you're having some of these problems.
Yeah.
But yeah, so
unfortunately, they don't think about that.
Yeah. No, they don't. And I think then too, younger people in their young 50s, right, are like wanting to get pregnant. Women are waiting longer to start families, and they're struggling, and they think there's something wrong with them. And there might be something going on that people aren't talking to them about. So yeah, it's good that you guys are getting this message out there.
Yeah. No, I think that's a great point.
It's yeah.
Yeah. So when you guys are working with your clients, what do you focus on? Providing hormones or diet, exercise? Probably all of it, but tell us from your point of view what that looks like.
Go ahead, Angie.
Go for it, Jen.
Oh, me? Okay. Yeah. So neither one of us prescribe hormones. So that's the first thing to just mention, that, we don't prescribe. Nurse practitioners can prescribe and providers can, but we do not. But yes, we absolutely discuss hormones. And we also discuss that that's not the only thing. It's not an easy button. It's not the only thing that they can do. So like Angie was alluding to before, we use our assessment skills as nurses. So it's not just, it's not like you go into a provider and say, I feel tired, I feel this, I feel that. Oh, you're depressed. Here, have this drug. We say, what does your day look like? How are you managing your sleep? How are you eating? How are you exercising? We're looking at all these different things. What's your stress management? Are you in a relationship? Is it a good relationship? We're digging into all of it to see what different factors are that we can look at and say, all right, well, let's work on your stress management. It sounds like you're not getting enough protein. What do they think is going on? Because as one thing that we really lean on as nurse coaches, especially, is we believe that we know our bodies very well. Like everyone knows their body better than anybody. If I have a patient come into me and they say, I don't feel good and this and this and this, and this is why, because this always happens when X, I'm going to believe them. I'm not going to be like, well, that doesn't make sense, because they know their bodies. So we'd like to dig in. We ask the questions to help them kind of come up with, oh yeah, you know what, this usually works, or this, I always feel bad on this day when I do X, Y, Z. Okay, so maybe these are the things we need to tweak. So we're really digging in deeper than you can do in a 15-minute conversation. It's a solid hour conversation of really digging in, sure, finding out what's going on. Yeah, Angie, I don't know if you have anything you wanted to add to that.
Have you guys?
No, I mean, that's 100%. And also not all equals empowerment, right? And, we're just trying to put it together with them and partner with our clients and keep, there's accountability. And Jen and I talk about this a lot and remind each other of what nurses bring to the table. And, is really, I was going to say therapists as well, I'm sure, but, empathy and intuition. There's not a nurse out there. I don't think you could survive, if you will, as a nurse for that long if you don't have that true intuition. And it's really, it's how well researched that is, but there's many, many stories. And, it goes back to like when doctors say, trust the nurse knows, or whatever, certainly it's a collaborative effort.
Of intuition, but that makes a lot of sense of just having this kind of gut connection to what someone says. And you're like, yeah, I think there's something here.
Yeah. And when you're a young nurse and I think you bring that to the table, but then you learn, just like visually when you see people, it's almost like, oh, you don't feel good, or, or especially people in the hospital, like, oh, something's going to happen. You have that, like, it's hard to put in words, but
intuition.
I think it's just what we bring. It's two of our superpowers, because we all have to, as professionals, have to differentiate ourselves and show how we're different and how we help people differently, right? And as it takes a village. And my favorite people to work with on a team are therapists. So that's another reason why I'm happy to be here today.
Yeah.
Oh, wonderful. Do you get a lot of people referred to you by therapists?
Not at this point. I have just led a few events, or I'm going to lead another event here in June, and people are involved, people that are a part of my team, if you will, spreading the word about health and midlife, are therapists, just really leaning heavy on the mental health side. Because I just think there's so much going on for women in midlife, not only their physical health, but physical, mental, emotional, but socially, financially, occupationally, just there's so much change going on for women. And
I know, for me as a 50-year-old woman, and like really getting to a part in my career where I'm feeling excited about it again and just kind of motivated and really confident. And so that plays a big role, and want to keep that going. And I'm like, no, I want to do this as long as I possibly can. And it's just, it's an exciting part, but yet then you have these things that pop in. And it's like, I can't get everything done that I want to get done,
and you may not be feeling like yourself, right? That's one of the the complaint of brain fog is so real, right? And learning how to adapt and what else you can do to, work with that. And so you can continue to excel in the workplace, if that's what you wish to do. Because as you're saying, so many women at 50 are at the height of their careers, but not feeling great. And so that's where Jen and I come in. No, I don't know. Just one instance anyway. One example.
I think that too, just even having the conversation and having it be a more general conversation where everyone can kind of talk about this and understand it. Because if we're women in the workplace, right, and brain fog happens or something happens and I'm having a rough day or what, I don't like work in an office setting with people, but like it being okay to be like, this was one of those moments where it just kind of brain fog, like I can kind of not like blame it or put an excuse out there, but just the understanding that this is real, like this is happening in my body. Mm-hmm. So it makes sense that something that I know by heart, like in a moment, I can't think of it, but it's okay. Like, and I think women can be really accepting of that, but maybe men, not so much. And I don't know, I'm just throwing this out there, but like, if we can talk about it more and make it more real and just make it more accepted that this is a real change. And it doesn't mean we're not capable. It doesn't mean, we, can't still bring so much.
It's so much. And they need us. The world needs us at 50.
I do need you.
Yeah. We have so much wisdom to bring into the next chapter.
Exactly.
And women. Yeah. And to normalize it.
That was the word I was looking for.
Yeah, that's exactly what I was about to say. Normalizing the narratives. I mean, Angie and I are very passionate about that. And part of why on our channel that we're just talking about all of these different things, these symptoms you can have, these things that you might need to help you get through it, because it is part of normalizing the narrative. Literally, I was just talking with somebody the other day, and I was talking with two women, and my brain it just really wasn't working. But I was lucky. I was talking to two women. They understood it, and we could have a conversation about it. I think it's like, to me, it's so funny that, because especially like, go back to think about what Angie said about, periods, postmenopausal and sorry, post pregnancy and perimenopause. So when we're children, we're taught that, that the period is like, you whisper, you don't talk about it, right? We're going through it, don't tell anybody. Oh, hide, and they're laughing at the girl who leaked, shame, what have you. But when you're pregnant or trying to get pregnant, we're telling people, oh, we're trying. Okay, thanks, didn't need that visual, but like, we're so open about it. You've got this belly that's like, hey, I'm pregnant, everybody can talk about it. I have to pee. I'm hormonal. I'm crying all the time. All of that is accepted because there's a visible thing sticking out of your belly that says,
Yes.
I can talk about this. And now we go back to getting, whether you want to call it in the closet or whatever you call it, where we have to whispering the word menopause. We can't talk about the symptoms. It's going to make us sound old. It's going to make us sound dumb or whatever it is. And it's like, no, if we talk about it, people will start understanding it, and then they know what it means for you to say that. It doesn't mean I have dementia, I'm never going to be smart again. It means today is a bad day and I can't remember what a fork is called. Like, it's not that big of a deal.
What is that in Little Mermaid? The dingle hopper, a dingle and the Little Mermaid.
I don't remember.
The dingle hopper to comb her hair. It's a fork.
Oh, it's a fork. Gotcha. Yeah.
A little side note. There you go.
Yeah, so if you can't think of fork, maybe you can think of dingle hopper.
Dingle hopper. Yeah, I would probably more likely think of dingle hopper than fork at this stage of my life, for sure.
It's interesting you say that about the visual of, right, we can see what's going on, because even, right, postpartum, when there's postpartum depression, it's a very secretive thing. And the only time, unfortunately, people talk about it is when terrible things happen, right? And so that visual. And even during pregnancy, not only are we allowed to talk about it, but strangers are allowed to come up to us and all their thoughts about our pregnancy.
Yeah.
And touch us.
Touch us.
Yes. Yeah, maybe we need to go back to the old days, when people were grieving and they'd wear that thing around their arm that showed that they were grieving. We'll have a menopause wrap. Just so everybody knows, hey, this is what I'm going through. This is your visual to give me a break.
Yeah, kind like.
Well, Jen, you say that, and I just immediately comes to mind is really understanding the age of menopause. And like, I mean, I love the idea about maybe putting something on our arm. That's fine, whatever. But I also think like, people understanding that, the average age of menopause is 51 years old, 51 and a half. So if someone is around 50, 51, I mean, that's average, right? That, try to understand what they're going through, right? Or how their body is changing. And, hopefully with menopause having this sort of movement and so much attention, the younger generation is also paying attention and they're learning from their moms so they can have a better understanding and maybe give a little bit of, we don't want to have people feel sorry for ourselves, but just a little bit more understanding and awareness of what's going on. And I feel like we've made so much progress around postpartum depression, and that it's not, dads are contacting maybe a therapist or a doctor, saying, this is really, my wife is suffering. We've come so far, I feel like, on the reducing that stigma. And it's talked about a lot more than it was, I would say, 25 years ago. And I hope it doesn't take this long around menopause. But, for those severe cases when people are really suffering, you hope there's someone has an advocate. I mean, and that's part of Jen and our jobs too, is to help advocate, and which we've already mentioned. But it's just so important to have our partners know what's happening in our bodies as well.
And you say average age of menopause, right? And menopause is really just that one day.
One day.
It's been a year since your last period.
Yes.
So it's not like when you start the symptoms, right? That's like the day.
Well, kind of, I think for, my generation, our generation is, people are like, oh, I think I've gotten through it. I'm through it. I think I'm through that menopause. It's just like, Well, you are, but if you've gone 365 days without a period, you've hit menopause, and now you're in menopause for the rest of your life. You're never really through it. I mean, certainly symptoms can reduce, but our bodies continue to change with that reduction of hormones. And so that's where MHT can come into play.
Do our hormones continue to decline after that?
No, when you've at 365 days at that menopause, your estrogen and progesterone are pretty flat, and they're not. And so what's different is in those perimenopausal years, it's so erratic. It's chaos, right? With those hormones, people have, termed it that, just like river rafting. And then once you get it, that's why symptoms can sort of you can have a reduction in symptoms, although your body is still changing, or, you're aging, right? We're all aging. But yeah, at that point after menopause, those two hormones are flat.
Okay.
Yeah, I think your body gets used to it too, right?
We adapt. Yeah, I think so too.
Yeah, your body starts to get used to the fact that, like before, like Angie was saying, it's all over the place. But then after you pass that 365 days, it takes a little bit time to completely just be like, oh, yep, now I'm used to this.
Yeah.
But a lot of people see after 2 or 3 years after that date that a lot of their symptoms improve. Not all of them. Some of them might still stick around. A lot of that depends on how you're eating, how you're exercising, that type of thing. I don't know what Angie was about to say about testosterone, but that after about 65, it does start to come back up. You see your mind and your resiliency and your happiness levels start to come back up after the menopause transition as well. So there are a lot of really great positives. I think that we talk so much about the negatives and the things that are happening. And a lot of people really grieve that loss of the ability to have a baby, even if they weren't planning on it anyways, that now it's absolutely gone. There isn't a choice. So a lot of people grieve that loss, but there are a lot of fantastic things on the other side that I don't think we give enough airplay to. And like I said, it's that testosterone goes back up. So whenever you're working out and stuff and you wake up, you feel a little bit better, you feel a little bit more energized, your happiness curve comes back up. So you start to have that more, it's not that you don't get bothered by things, but they just don't bother you quite as much. You lose the maybe the Debbie Downer side of it, but you keep the positivity side of it. So it's almost like this loss of this and the increase of that gives you this increased happiness level, which is fantastic, right? And I think that I actually read that like a study says that women in, I think it was the early 80s, maybe like 83, are the happiest of all ages, right? So if you look across the age spectrum at 83, how fantastic is that? That we are just going to keep getting, like, once we get past this, we're going to keep getting happier. I mean, how fantastic is that?
Yeah, that's awesome. Make it to 83.
You will. You got it.
Yeah.
Well, and a big piece of our podcast is talking about healing. And so we are curious just how you have seen women heal, or just clients that you've had heal through either the work that you do with them or the knowledge you can bring them.
And maybe healing is part of like this acceptance and compassion and love for themselves and able to move forward.
Yeah, I think you just nailed it for me. And that's what I've seen the most is like, I've done some menopause education group classes, and it's, from the first night that we meet to the last night we meet, there's just like, sometimes it's just, I see a weight off someone's shoulder, like, cause they just have a better understanding, and they're like, oh, this is what's going on. This is what I need to do. So just that empowerment factor of like, and what you said, providing education, support, connection, just, I think that can lead to healing. I mean, and that's what you guys are, that's your mission too, right? Love that.
Yeah.
Connecting women is what I'm all about as well. So
yeah, community. Yeah. And I really think for me, I really work with people on their awareness of what's happening in their body, and to connect the dots in that way. And I find that, whenever we're working on goals and stuff, we focus on an intrinsic motivator versus extrinsic, right? So intrinsic means it's how it makes me feel. I'm going to set this goal for myself because it's going to make me feel better. I'm going to have more energy. I don't want to suffer anymore. Whatever it is about how you're feeling, it's an emotional component. Whereas that extrinsic is, I want to look better in the mirror. I want to fit in my pants. I want to go to my reunion. And, it's kind of these other outside factors that it's really for someone else. So when I find that people start leaning into, I'm going to do this for me and how it's going to make me feel, that not only do they heal because they have stopped worrying about what's right for everyone else, but now they're actually creating a lifestyle, not just a diet, not just a crash exercise, not just a feel better for this 1 second. It's a lifestyle of that just takes a weight off of your shoulders, because now it's not, I can't eat sugar. It's, I don't eat sugar because it makes me feel this way. Now it's not, I have to exercise because I'm fat. It's, I exercise because I feel better and I have more energy for the day. And I really think that that's the way I'm seeing a lot of people, on top of what Angie was saying, but just healing in a way that they aren't, I don't know what the right word is, but they're not held down by these beliefs that we've been fed our whole life. We have to be thin. We have to count calories. We can't have that cake. That cookie, if I eat this cookie, I have to go run on the treadmill for 20 minutes. We throw all of that out of the window. Let's start living for ourselves. Yes. And whatever makes us feel good is what we should be doing.
Yes. I like it. Throw it out the window.
Throw it out the window.
It's gotta go. It's gotta go.
And this is the time of life you can do it, hopefully, right? I mean, that's another bonus. The menopause and the menopause zest, if we want to call it that, or the glow of menopause. Yes. It's one of the positives.
Yeah.
Is to be able to let those, put things out the window.
Yes, right. I like it. So also, we're getting close to the end, but we like to ask about, so giggles and glimmers is kind of our tagline, I suppose. Mm-hmm. And we like to kind of reflect on giggles that we might have had in the past year or week, year, and then glimmers as well, as far as like something that you did or that you observed that really just kind of brought hope or joy or gratitude that just warms your soul. So I guess pick a giggle or a glimmer if you guys want to share. I haven't really thought about any myself this week, but yeah, any giggles or glimmers on your ends?
I just love the giggles and glimmer. Right? That's such I really applaud you in that message and providing the space to think about giggling and the glimmers, right? So important. So important.
It is important. I'm trying to think of giggles.
I had a glimmer this morning. I was like, ooh, I can use that. And now I don't remember what it was. Well, there's your giggle. Ha ha.
I love it.
And how important it is to giggle, right? My goodness.
Yeah.
The science around giggling.
I mean, laughter is so healing.
Yeah.
My goodness. Yeah.
Yeah.
Mm-hmm. Absolutely.
All the stuff it does for our brain.
Is it connected? It is. Yeah. It's connective. It's connective.
Absolutely. I love it.
Well, I had some giggles last night. Oh.
No, you're good. Go ahead.
Yeah. Yeah, Angie.
I was just learning the Mahjong, the game, and gaming, and I was the only person who had never played the game. And so this was last night, and sitting around with just new women in my life, and some old, some new, and just the laughter. And it was a lot of like, oh, can't remember that anymore. Like, oh yeah, and and there was a lot of giggling and laughter and connectivity to your, and I think games can do that for people. And such a good activity.
Yes.
Sit down with people that you like or not like. No, I don't know.
Right.
Just and have to play.
You create that connection. And then if you're working with women or playing with women of all ages and you're like, oh, I forgot how to do that. There's like camaraderie of, I totally get it.
Yeah.
Yeah.
No pressure.
Yeah, it definitely helps. Yeah. Yeah, making friends at this stage, that are going through it, is definitely helpful. For me, I think, so glimmers, I'll tell you, as coaches, we work with our clients and stuff, and we're providing our clients with a lot of great, sage advice and ways to get motivated and all this stuff. But it's amazing to me how much they provide me, because I will be working through things and I'm like, oh yeah, I remember how good I felt when I was doing that. Whenever they're talking about something they're going to do, I'm like, oh, I'm going to go do that now, And it's just like I get such an energy from talking with my clients, from even if it's virtually, like usually I only get that energy from being in a room with somebody, but the energy that I'm able to get from them, and seeing whether it's their shoulders drop, because they're like, oh yeah, this doesn't have to be that hard, or just making some kind of connection. I just think that's so, like, to me, that is something that's going to warm my heart. That's going to make me just, it makes me obviously want to keep going and talk to as many people as I can. And then I think a giggle, no doubt it's just the ridiculous crap I can't remember anymore. Like, and I can only laugh at myself. The other day I was making a pot of tea and I turned to get something out of the refrigerator and I'm like, why is the water running? Because I turned it on. I'm making tea. like how ridiculous. It was 2 seconds, If you can't laugh at it, you will lose your mind.
Exactly. I'm like, if you can't, giggling at that and is essential. Yeah. Same thing. I sold something on Marketplace and they paid me in cash and I had it and I was going to put it in a new location. And during the time that I had it and going to my purse, I lost it. I'm like, where did it? I just had it. Where did it go? Looking in all the usual places, but then I picked up like this pouch that I was, I guess, carrying with the money, and it was right underneath it.
Of course it was.
Of course it was. So yeah, if we don't laugh at those things, we'll just not be happy people.
Very true.
Yes. Should we do our question? Yeah. So to end it all, we pick a question out of the bowl, and they're not. They're typically not serious. They're very random. We don't know what they are, and we all answer it. So it's not just the two of us.
Fun.
Yeah.
Great.
Okay. So this might be kind of long.
We'll keep it short.
Describe your ideal day. Yes, your ideal day. What does that look like?
Mine's super short. I can answer this quickly. Nothing. Okay. Absolutely nothing to do. To have nothing to do is my ideal day. To get to choose whatever I want to do all day long. That is my ideal day.
That is a good.
No time constraints.
That's right. No time constraints. I don't have to be anywhere. I don't have anything that has to be checked off of the list. I get to choose whatever whether that could be going for a hike. It could be laying on the couch. It could be sitting on the porch outside. It could be a number of things that I enjoy, but I have nothing else that I have to do. That's like my ideal day.
That's a good one. Yeah,
that's really good.
My ideal day is spent outdoors as much as possible, in fresh air, moving in all sorts of ways, running, hiking. I, kind of opposite to Jen, I always feel like I have to have something planned, and I think that's, but I'm going to think about this now. Thank you, Jen. Like maybe I need to go a different direction on this, but love conversations, learning, and I guess just putting myself in positions to learn and grow. I guess that's an ideal day. Would you movement and fresh air as much as possible?
Alone, or would you be with somebody?
Well, it's changing. I think, this past weekend, I ended up going up to Wisconsin and running a trail run on my own. And I don't think I would have done that 10 years ago. I would have thought, well, I shouldn't just go on my own. I'll stay home with my young children, or if I was planning on going with a group, I would go with the group. But this group, people were injured, couldn't go to the run. And so I just went by myself and met some people in this lovely community in a small town in Wisconsin. Awesome. And ran the race and felt really good about it. So I think that's changing. And I think that's something to do with me. I don't know, maybe I'm finally maturing in life over 50. I don't know, that I can be by myself a little bit more, but I think that's part of this chapter for me. So, but usually it's been with people, and now I feel like I'm spending a little bit more time on my own. So
yeah, I think that's a glimmer
something to think about.
Yeah.
Something
to think about. Catherine?
Thanks for asking that question.
Yeah. Well, I think mine is almost kind of a combination, because I do like to steal the idea of not really having any expectations or having a certain schedule. But I like the idea of waking up and getting outside in the sunshine, having some movement. But I also like if there were something later in the day where there was a connective piece of going out to dinner with my favorite people, or, sitting on a patio and like just relaxing with people and like playing games. I love playing games. So I think it'd be, some space for me to be outside in the world on my own with some sunshine, and then some space with my favorite people.
Nice.
I like that.
Yeah, me too.
Okay. Every single one. All of your days are my except for maybe the running. No offense, Angie. I'm not a runner.
Well, that's okay. You're not alone. You're not alone.
No, I like not having time constraints. I like a slow day. I don't like being rushed. And I like to just kind of savor the moments, whatever they may be.
Good.
Love it.
Well, do you guys, have anything you want to promote, like these classes that you're doing, Angie, the YouTube channel? Jen, are you gotten anything in the hopper?
But yeah, so definitely our YouTube channel at Nurse Coach Duo. At Nurse Coach Duo is our YouTube channel. I have a business called Clarity Health and Wellness Coaching. I'm here in Missouri. I can coach in some states outside of Missouri. And just, you can contact me and I can let you know about that. I'm actually going to be talking to some therapists in October, so that's exciting. Doing speaking at Theramama. Yeah, so yeah, I'm excited about that. But yeah, those probably those two things. And then Angie definitely has something cool to promote.
Yeah, not only our Nurse Coach Duo. So I have my company is Coach Angie. Pretty straightforward in Oak Park, Illinois. So I only coach in Illinois, and I coach under my license in Illinois. I can't coach anywhere elsewhere. And I love to coach in person, but certainly can do virtual work with people if they're not close by. And then I have I'm working on a project. It's my midlife women's summit in a suburb of Chicago with all different practitioners. But like I said before, like heavy mental health support. And then, so yeah, it's going to be a great day. So it's like an afternoon. It's just coming together, but it's exciting. And Jen's going to be here, which is great.
Yep.
Yeah.
Awesome.
So always something in this coaching nursing world. We're figuring it out.
It's needed. We need you guys so much. So thank you so much for being on and normalizing this whole transition in our lives. And yeah.
Thank you for having us. Thank you so much.
Thank you so much. This has been a glimmer. Are you kidding?
Yes.
And a giggle.
Absolutely.
Yes. So to close out, we are TheraSisters STL. Yes, I'm Catherine Barton, Amy Camp Ryan,
and you can follow us on Instagram at TheraSisters STL. We're on Facebook and YouTube, and we put out a lot of giggle and glimmer clips. We're trying.
Yeah, definitely recommend everyone to follow them because you guys are great.
Yes.
And the Nurse Coach Duos.
Yes.
Thank you.
Thank you. Bye.
Thanks for hanging out with us on the TheraSisters podcast. We're so glad you tuned in.
Don't forget to subscribe to our newsletter for more healing goodness, events, laughs, and all the good stuff we don't want you to miss out on. Until next time, wishing you giggles and glimmers.
Out.
Out.